Hello, my name is Dr. Gregory Davies, and I am a professor of Obstetrics and Gynecology at Queen's University and the president of Stittsville Medical Imaging Center, where we offer the Mona Lisa Touch as a treatment option for the common vaginal and vulvar discomforts associated with menopause. In this chapter, I am going to introduce the concept of the genitourinary symptoms of menopause, symptoms that may affect your vulva, vagina, and bladder, impacting intimacy and your overall enjoyment of life. The term genitourinary symptoms of menopause is used to describe the effects of a lack of estrogen on the vulva, vagina, urethra, and bladder. The typical symptoms from low estrogen of the vulva include itching and burning. When the vulvar skin gets very thin, there may even be some bleeding. The typical symptoms from low estrogen in the vagina include dryness, discharge, odor, painful intercourse, and bleeding after intercourse. Due to the lack of estrogen to the vagina, vulva, and clitoris, some women may have increased difficulty achieving orgasm. The bladder is also affected by the lack of estrogen after menopause, resulting in symptoms like recurrent urinary tract infection, pain with urination, having to urinate frequently, having to get up at night to urinate, getting strong urges to urinate, not being able to get to the bathroom on time, or leaking urine with coughing, sneezing, or exercise. Unlike hot flushes, which generally settle with time, the genitourinary symptoms of menopause tend to worsen with age. This graph demonstrates how quickly women develop genitourinary symptoms of menopause and how many women are affected. Prior to menopause, only 3% of women have symptoms, but within 3 years of menopause, almost half of women are affected by symptoms, and 60% of women with symptoms describe them as moderate to severe. One group that are particularly affected with these symptoms are women who have undergone treatment for breast cancer. As estrogen is not commonly used by breast cancer survivors, and removal of their ovaries may be a component of their treatment, they commonly suffer from genitourinary symptoms. 23% of breast cancer survivors have symptoms before menopause, and 70% after menopause. In this survey of 3,046 women with genitourinary symptoms of menopause, 60% said their symptoms affected their enjoyment of sex. 24% said their symptoms affected their sleep and overall enjoyment of life. Only half of these women had discussed their symptoms with a healthcare provider. Almost 2/3 of women were self-treating, buying over-the-counter creams and lubricants that only have short-term effect, and only 11% of women were using prescription estrogen. There are some serious negative consequences of having vulvar, vaginal, and bladder symptoms. Some 3/4 of menopausal women report negative effects on their sexual health, which can have an effect on their self-esteem and their relationship with their partner. In addition, affected women may avoid activities like exercise that can aggravate bladder leakage. So it's time to start talking and doing something to improve or even completely get rid of the genitourinary symptoms of menopause. I hope you found this review educational. If you would like to book your consultation to discuss the Mona Lisa Touch treatment for the genitourinary symptoms of menopause, call Stittsville Medical Imaging Center at 613-714-1000.